we're starting now with our first part, talking about health. First MEP to start is Sarah Seres here on the screen, and of the SND group. Sarah is from Portugal, and by training a medical doctor. She is also the vice chair of the Special Committee on Beating Cancer and the S&D Shadow Rapporteur of the EU for Health Programme. In addition, she is the co-chair in the European Parliament's Working Group on Health. Right? So wonderful to have you here, Sarah. She has a very strong interest in mental health in particular, and very well placed to interview our guest, Dr. Ann Speckens. And just a few words on Professor Ann Speckens too. She is professor of psychiatry at the Radboud University of Medical in the Netherlands and founder of the Radboud UMC Center for Mindfulness. The center offers mindfulness and compassion courses for both clinical populations as well as for healthcare professionals. In addition, Ann Speckens was involved in the mindfulness program at the Dutch National Parliament. Now, the topic they will explore is the role of mindfulness improving mental and physical health at the individual level, and what the impact of mindfulness could be at the system level to improve both the effectiveness and the affordability of healthcare. So thank you for your patience, a bit of a long introduction. Sarah, I'm handing it over to you. I'm very curious. Thank you.
Thank you, Jaron. Good afternoon, everyone. Thank you very much for having this event and for inviting me. It's my pleasure to host it, especially with our first guest in order to speak a bit health and mindfulness. And I'm very much looking forward for this 20-minute conversation and for all the questions from the public. And I'll start with Dr. Ann Speckens with quite an interesting question, which is that mindfulness is often sold by the media as a miracle cure. And you being a medical doctor and researcher, what will you highlight as being the main benefits of practicing mindfulness in terms of both mental but also physical health? And also, could you share with us where is the evidence the strongest?
Thank you very much. And thank you for this invitation to be present with this interesting event. As you said, I'm both a researcher and a doctor, and have been practicing and teaching mindfulness for 15 years now, I think. And mindfulness teaches us to be present with both the pleasant and the unpleasant parts of life. And not only for patients, but also for doctors and for us as sheer human beings, as we are together this afternoon. We know that life is not only pleasant, but usually the unpleasant, the difficult side of it, we sort of react to with automatic patterns and reactivity with things like denial or repression or fear or anger. And mindfulness teaches us to be present in a much more open-minded way, with less judgment, with more kindness, curiosity. And from that attitude arises a much more wise and helpful way of dealing with it, with difficult situations. And that is particularly useful for patients, both with mental disorders and with somatic conditions, actually. So what we know from the scientific evidence, which has been accumulating now from 2000 onwards, so nearly 20 years, that mindfulness-based interventions can help to reduce anxiety and depression in people suffering from psychiatric disorders, but it can also reduce psychological symptoms in people with chronic somatic conditions like cancer or Parkinson's or multiple sclerosis, and can actually improve their quality of life. So those are very important areas to implement it. And as a third group that I'm personally also involved in, the healthcare professionals themselves. So it can help them to support them in a profession that is very demanding, and particularly at these times of the COVID pandemic.
That's great. I'm just taking notes of this very interesting response that you have been telling, giving into the scope of these three sort of more points that the mindfulness can help with, which is with people with already mental disorders, people that have some symptoms that and other somatic pathologies, but also some professions, in particular healthcare professionals that are indeed faced with a lot of demands in their work, especially now with this pandemic. The hearing that I've been receiving from my colleagues in the ground is quite astonishing, and I truly believe that we all have a say. If we can prevent this pandemic from spreading, it can be to help our colleagues in the ground that they are facing high loads of demands and in these scenarios. So I'm also trying to connect a bit with what we're facing through with the COVID pandemic, but I would like to understand a bit more of what exactly is mindfulness. So everyone hearing us already knows what we are exactly speaking today, because we already know about the benefits. You spoke very briefly and very broadly about the benefits. They look amazing if we can actually cope with unpleasant situations with these results is quite it could have important benefits for not only for the individual but for the whole society. So if someone were to start practicing mindfulness today, how quickly could one expect to see results? And how is the evidence in this regard? But I understand that there's, of course, research done for specific groups. So in this regard, I would say for the someone that has not a mental disorder but actually wants to start mindfulness, what is expected from it?
Well, let's start with the definition you ask about. So what is mindfulness? And it's actually a mental skill that people can sort of, that is innate to human beings, and we can develop of bringing our attention to the present moment, and to face up, acknowledge that moment, both the pleasant and the unpleasant parts of it in a kind, open-minded, friendly, non-judgmental, curious, but also with curiosity, but also with discernment, and and that all in the service of a life with less suffering, with a greater well-being, not only for ourselves but also for the people around us and the world. And not only people with clinical disorders or somatic illnesses can benefit from mindfulness, but also people like us who don't have yet maybe somatic diseases, because that is shared humanity as well. And actually, people can start to benefit from that pretty quickly. I'm teaching a crisis mindfulness intervention now to COVID-19 frontline workers, so nurses and doctors and even supportive personnel. And they pick up from the course, they pick up very quickly to be aware, to sort of pay more attention to their body, to pick up signs that they need to take a break, or that they need to set limits, that they start to better take care of themselves. They notice that they need time to and space to allow emotions that they can't allow during their work, during the daytime. So all these kind of changes can take place pretty quickly. But of course, it's not something. Mindfulness is a way of life, and it's not something that you usually can sort of finish in 8 weeks' time. So the courses that we teach, the intention of them is to get people acquainted with it, to sort of get to start people off on a path in which they can develop mindfulness basically throughout the rest of their lives, and can think of ways to integrate it And sometimes people make actually quite significant changes in their life as a consequence of the mindfulness. They change jobs, or they decide to work less, or they to spend more time with their children, or to yeah.
Yeah, that's great and quite interesting. So it's something that can follow us throughout life and can actually, it's interesting because it can provide us a toolbox that we can reach whenever it is needed. You already mentioned that you're involved into working with healthcare professionals, but I also have to note here that you work with education professionals, criminal justice, and businesses. And in your sense, now that we talked about the individual benefits, in your regard, what will be the impact and benefits do you envisage we might see at the wider system level, in particular with regards to health, with if we mainstream mindfulness practice?
Yeah, if I look at the healthcare section in particular, I think there are important benefits that we might bring on a systemic level. So if people become more aware and make more conscious choices, if we look at the patient side, they might be able to develop more self-management skills, to make wiser choices in how to adapt to illnesses, but maybe also to adopt a more healthy lifestyle in which people can actually prevent illnesses from developing. If we look at the healthcare professional side of it, if people cultivate mindfulness, it might result in more sensitivity for their patients, in a more open mind, in adhering less to their own views and being better in shared decision making. So that and that might significantly improve quality of care. And in terms of the culture in a hospital, for instance, if the professionals are being able to support each other more effectively, and there might be a more compassionate culture or way of working together, that might really sort of prevent people developing burnout or even leaving the profession, which is quite a big problem in the Netherlands, and I don't think that will be very different in other countries.
Yeah.
So,
yeah, that's actually great news, because just giving a bit of insight of my own country, in Portugal, we have that 40% of junior doctors
yeah,
are on the verge of burnout.
it's such
And
a shame. And
yeah, yeah, and we are taught at medical school that we should format in a certain way. Compassion and the attention to the patient-doctor relationship sometimes goes into a secondary role, and this more addressing us as also being healthcare professionals, but human beings above all, it's quite important. So I really hope that this practice becomes mainstream, not only in the healthcare professionals, for healthcare professionals, but for most professions. And going a bit more into my current professional role as an MEP. So now we have 3 MEPs in this event, and what would be your message to us? What needs to happen at the EU level, and what can we as MEPs, legislators at EU level, can do in order to help?
Yeah, what I think is really important, I just said that research in this area is about 20 years old, so it's actually increasing, and I just looked it up yesterday. I think there are more than 18,000 papers on mindfulness now, and to implement that evidence, so to make these interventions, these mindfulness-based interventions, accessible to people with mental health problems, but also to people with somatic illnesses like cancer. It can really support those groups, and to integrate it in the healthcare system itself. So the training of medical doctors and nurses, and in the professional development of them. Yeah, to support them in their work.
This is quite interesting because right now, as Joran has introduced me, I'm one of the negotiators for the new European health program, the EU for Health, which is a program that runs from 2021 until 2027. And we're actually, the Parliament has a mandate, and we want to address mental health, and mindfulness can be one of the skills, tool skills that can actually improve and address not only for those with somatic disorders, but also for a general way of improving life and well-being for everyone. And actually this can have important results in regards to better health gains. So what politicians like to know is this can actually save us a lot of money by having healthier and more well-being individuals out there. So my final question, because we are almost running out of time, is Dr. Anne Speckens, is where can we get more information, further information on these practices, and also on how can we advance this practice?
Yeah, there are a few good mindfulness center, university mindfulness centers in the world that provide good information in English that might be accessible. So that's the Oxford Mindfulness Center, the centers of Brown University in the United States, and also that of Richard Davidson in Wisconsin Madison. And for the Dutch-speaking people amongst you, I've added our own center as well.
That is great. And I've just seen in the chat group that we have all the links. So anyone interested, feel free to go, and let's all work together to mainstream this practice, as I truly believe this can be one of the tools we have in our hands to further improve health and well-being across the EU, not only in the EU, but also across the world. So thank you very much, Dr. Anne Speckens, for this lovely conversation.
Wonderful. Thank you so much, Sarah. Thank you so much, Anne. This has been a very rich and wonderful start of this session so far. It's very inspiring to hear, to immediately see the connections between, in benefits at the individual level, benefits in organizations, in hospitals at this critical time. And then immediately to hear that MEP Cerdas also sees something to immediately include in her policy work. So very inspiring, wonderful start. Thank you so much. I'm going to transition now, but anyone who is watching, if you have questions, you can type them in the Q&A box, and hopefully Sarah and Anne can stay a little bit longer. I know they're extremely busy, so if they can stay, they might be able to answer those questions a little bit later during the Q&A. Okay, so thank you so much again.